Hi, I'm Kat. I'm an esthetician here at Premier Dermatology, and today we're going to be doing some microneedling on Kara. You can see she has a little melasma that we're going to take care of here. This is one of my favorite treatments for melasma because it really helps to break it up. We're going to get started today by getting her face nice and cleaned off here. I've already got the numbing cream off of her, so now we're going to just do some alcohol wipes. This is not Kara's first time doing this. She loves doing this treatment. We like it for a lot of different things too besides just melasma. It is great for acne scarring. It's great if you're wanting to help smooth out little fine lines, little wrinkles that are coming up. Kind of just overall anti-aging. We can also do the neck and the chest with this. We're just gonna do the face though today. Now we're gonna get started with the needles. This is a one-time cartridge that goes on the end of this pin. There are 14 needles in here that are perfectly sharp, perfectly safe. This is sterile and it is a one-time use. And this is what sets microneedling in office apart from doing it at home or with a roller. This is super safe. We don't even sterilize this in office with our state-of-the-art sterilization. We throw this out and use a new one every time. So it's completely safe, always sharp, perfect needles here. Now we're gonna get started. On the forehead, we do different depths with each area. So we're gonna start here. We go in a certain pattern. There's 3 different patterns that we will do across her skin. How are you doing, Kara?
Great.
What's it feel like right now on the forehead?
Just a little tingle, but I wouldn't call it tingling.
Like a little scratchy?
Yes, that's a great way to describe it.
So we do the cross-hatching pattern first, and then I go back in with these little circles here over the melasma area. I just want to hit that area a little bit harder.
Absolutely.
And I definitely go here in the crow's feet area as well. Just want to stimulate as much collagen and elastin as possible. The great thing with this treatment is you can never do too many microneedlings. You can't do them super frequently. You have to go 4 to 6 weeks in between, but you can do these as much as you want because it is just naturally stimulating your own collagen and elastin. Okay, now we'll switch and we'll do the other side here. This is just a little HA glide. It helps the pin to slide across the skin nicely. And the summer is a time that it's not as popular to do the microneedling because you do have to be out of the sun with this. That is one of the post-care instructions is you don't want to be in the sun for the next week at least. You want to be not like laying out, going to the beach, anything like that. You definitely want to be wearing your sunscreen. It's okay just for your everyday life, to and from work, out and about, but you definitely want to be wearing sunscreen and wearing a hat. After you do this, the very first day that you get it done, there's no strenuous exercise for at least 24 hours. And that is super important. We don't want anything getting in those pores and those channels that we just created. So she will start to peel. Usually that starts day 3. Today would be day 1. Tomorrow she'll look like she has a sunburn. She might have a little bit of like red dots over her skin where we go a little bit harder. That's called petechiae, and those will fade away in the next few days. But then day 3, she'll typically get peely, and it's gonna start around the mouth, and then it's gonna kind of work its way out. She's not gonna pick at it or pull at it. Just avoid the mirror if you have to. But it's my favorite part, honestly, because you can see the new skin underneath and it's just so beautiful. So when you're peeling and for the whole next week, you definitely want to be using very gentle products. My favorite products to use with this are the Ulta Foaming Cleanser. Then I like Recovery Complex, or if you're trying to work on melasma specifically, you might do the Obagi Clear. You might do a compounded solution that we order for you from the pharmacy. You might do Skin Medica Lumivive Day and Night, or just TNS Recovery Complex. Those are all very safe treatment products to use. And then you're gonna want a really good moisturizer, something really thick that's gonna like soak into your skin, so it gets kind of tight feeling when you're peeling. And then definitely SPF.
Do you recommend I use my retinoid?
No retinol. Some people will use it the first few days before they start peeling if they want a little extra boost. But I don't recommend that, especially if it's your first time doing it. You want to just kind of let it do its thing. If you're seasoned, you know you love to peel, you can do it the first few days, but it's not recommended after you start peeling. So you don't want to irritate that new skin. That would kind of defeat the purpose of what we're doing. So right now we're going on the cheek. I already changed the depth to a different depth. We go a little bit deeper on the cheeks because we can. And we're getting right up here, right on the orbital bone here for that micro needling of the melasma. And then we're gonna go in this little line here. And this treatment is safe for anyone to do because with the numbing, it's very comfortable. Any skin type can do this. If you're worried about it, we could always do a test spot, but this has been great on any skin type. You don't have to worry about hyperpigmenting or hypopigmenting or anything like that. I typically recommend this in at least a series of 3. That's where you get the best results, and that's, again, 4 to 6 weeks apart. If you're just doing a little maintenance, maybe quarterly or at least 2 to 3 times a year, I love it after lasers, after you've done a big resurfacing, but you just want a little boost, but you don't need that big thing again. It's awesome to do one of these. Or if you're a younger kid and you're just wanting to prevent, this is awesome for prevention because it's, again, just boosting that collagen and elastin production. With the acne scars, it really helps to smooth those out over time. It's not going to be one and done, but definitely with this series, you can get some really, really smooth skin if it's just those shallow acne scars. What's your favorite person to prescribe this for, Kara?
And, you know, I speak to melasma a lot just because I suffer with it. So I definitely send my melasma patients, but also those patients who really don't need a big procedure for, you know, skin texture, or
They just need like a perk
they
up.
just need a perk up. They need a brightening. They want to take off the dullness, you know, maybe strengthen those pores a little bit so they're less noticeable with makeup.
Yes.
That's perfect. I mean, it's such an easy treatment, and the minimal downtime just makes it available for everyone.
I mean, typically you are completely back to normal in a week.
Yes,
Like,
absolutely.
Easy. You could
Yes.
get it done on a Thursday. A lot of my people that work will get it done on a Thursday afternoon, leave a little early from work, come get it done. Friday, you can wear full makeup and they just look like they have a sunburn. So they can go back to work on Friday and be completely fine. And then they'll have their biggest peeling typically over the weekend.
Mm-hmm.
So they can stay inside, they can go see their friends if they don't care, see them like that, whatever. And then by Monday when they go back to work, they might be a little flaky around the edges, but not as bad as they were over the weekend. Now, if you're wanting to be fine by the weekend, I would do it on a Monday and then have all week to peel. And then by the time the weekend comes, you're fine. You don't want to go to church with your peely face. Do it on a Monday.
Absolutely.
So more of her post-care for after we get done today. She's going to be pretty red, have those little petechiae dots on there. She can't wear makeup the rest of today. She can't do any strenuous exercise the rest of today, not be outside, anything like that. So no sweating, basically. You just want to go and chill for the rest of the day. She won't put anything on her face tonight. She will just leave it be. I'm going to put some treatment cream on it that's going to sink in, and then she will start her gentle routine tomorrow morning.
What treatment are you going to put on?
So I'm going to do Triluma, which is a compounded cream that we send in here in the office. So that's going to burn a little bit when I put it on, but it goes away very fast. By the time we're done, she won't even feel it anymore. So that's going to sink in overnight, and then she will do a gentle cleanse in the morning. Okay, now for the nose. The nose is extremely tickly. Makes you feel like you have to sneeze. So if she sneezes, we'll just scoot back. But I always tell people, let me know so I can get out of the way. But this goes really fast. We're not going to spend as much time on the nose because you don't need to. And it's just kind of tickly feeling. But after this, we'll be done. So has it been bad?
Not at all. The
Good.
upper lip, of course, is always a little more sensitive, but
Yes.
it still was not bad.
Good. All done with that.
It was easy.
Now we'll get her all cleaned up here. This is just distilled water, so I'm going to take these and clean her off. Okay, now the Triluma. I like to do a generous amount of this so it sinks in. So this is the stuff that kind of stings a little bit. My go-to for after this is the UV Elements. I talk about it all the time. It's my all-time favorite sunscreen, but it's a physical sunscreen, so it's not going to be harmful. It's even good for post-procedure, which this would be. So I love that. I like the Revision True Physical. It's another physical sunscreen that if you want a little more coverage, a little thicker, that would be a good one as well.
I like it too. And do you feel like my antioxidants, like my CE Ferulip from SkinCeuticals, would be okay after this?
Yes. Great for in the morning. If it stings too bad, maybe give it a day, but it should be completely fine. And with that vitamin E in there, it's really going to help nourish the skin too. Okay, so we're all done. This was microneedling, and she's ready to go.